We'll just do another one later this week and sort it out. Can we? Yeah, we'll either have to tether or do something.
Tether from the beginning.
Yeah. Okay, guys. Sorry for the 800 billionth reconnection. If anybody has any questions on Facebook, I'm happy to answer. Instagram, YouTube, Twitter. I know this is crazy. Sorry, we've logged on and off. Mara, is there sound? Mara is the first one on every time. Thumbs up if there's sound, Mara. Let me know. And we'll see if everything's working properly now. Okay, follow-up question. Should we wear a mask on my wife's C-section scheduled with you in April? The hospital will give you, there's sound now. The hospital will give you instructions. So if you're entering the hospital, they will likely make you wear a mask. It won't be an N95 mask, but they'll probably make you wear a mask. And yes, they'll tell you when to show up at your pre-assessment appointment a few days in advance. Yeah, so masks, attire, gowns, all of that stuff, they'll tell you. Again, I want to warn everybody, I very highly suspect that at some point they will tell patients that nobody is allowed, including your partner. And I know how devastating that is, and that has serious health implications and mental health implications for everybody, but the reality is we got to do what's safest for all. So we will. And I guess we'll stay on longer now, like we did last time. Guys, if you have Instagram, YouTube, Twitter questions, we'll stay on for a bit to answer. Are FETs being postponed until COVID is over? Yes, everything is being postponed until COVID is over. We cannot do any kind of fertility treatments right now. Everybody is saying that it is a total no-go. That's hugely important. Lots of likes and shout outs to my family, who's going to get me a little bit later than I promised as I stay on because of our glitches here. If you're watching, please send love to Wendy and Jenny and Nessim. I got to edit an essay and fill out some paperwork, so thank you guys. Make sure you subscribe, make sure you follow, and make sure you share. We want loads of people to know about this, so spread the word so that we can help this thing grow. Okay, so Instagrammers, if you have questions, now is the best time to ask, since we are back online, and God knows how long it'll last this time. So let me know. Will frozen embryos stay at Nahal until COVID-19 passes? Yes. Frozen embryos will remain at Nahal until COVID-19 passes, for sure. We can't move them anywhere. Patient AF, thank you for saying thank you to my family. That's very sweet of you. And prayers for you too. I can't go home and sanitize yet. I got to answer all your questions. Should I advocate to add letrozole to my frozen transfer protocol if I suspect I have endo? Yes, absolutely. Letrozole and Lupron if you have endo. Or surgery and then Lupron and letrozole. That's actually sort of my go-to of choice, because then you clear it and you suppress anything that you may have missed surgically. So that's very reasonable. Have you heard of an increase in home births since this all started? No. Although, to be honest with you, I think that's probably riskier than going into the hospital. So we do know, and there is lots of data out there, that home births are riskier than hospital births. I definitely get it with the coronavirus that it's probably safer avoiding the hospital. However, if you or anyone around you is infected, then there is very little control over that. You can't really screen at your home. You're definitely not going to be able to sanitize sheets and a mattress and things like that at home. And so that definitely is a problem. So I would recommend staying with the hospital if I were you. I've done a couple of IVF cycles. I didn't know about baby aspirin before I started watching your videos. When do you recommend it? Everybody should be on baby aspirin during fertility. It reduces preterm labor. It increases success rates. It's a huge bonus. We have a fertility factor fiction on it from about 2 months ago, I think now. So go on YouTube and pull that one up. We discussed it for about 15-20 minutes. You should start it before you even try to get pregnant. All the studies that looked at aspirin started way too late. Get on it before you start. We do that for all of our patients. And we've had very, very good success with that. I think I already know the answer, but no IUIs during COVID, nada. We can't do anything. If anything ever happens to any of you, I am responsible. If something happens to your babies, I am responsible. We just simply can't take that risk. We can't even take the risk that something happens to my staff from you guys bringing it in here. So nothing that is not an immediate need. In fact, the only people that are getting fertility treatment are cancer patients where it's urgent or emergent. Nobody else should be getting anything. Does taking low-dose aspirin delay the menstrual cycle? It shouldn't, and I'm not aware of any data for that. Birth control or progesterone or multiple other drugs can, but not aspirin. If COVID-19 counties past 3 months after Lupron shot, continues. It says county, sorry. If COVID-19 continues past 3 months after Lupron shot and it needs to be redone, do you then wait another 3 months? No, as soon as it's over, we can roll you in. You can be on Lupron and get pregnant. That's not a problem. Okay. Can I talk about uterine fibroids and infertility? Sure. If you have a fibroid that is inside the cavity of your uterus, that's called submucosal. It has to come out because it's a 50% reduction in success and a 100% increase in miscarriage. If it's in the wall of the uterus, but it's big enough that it's distorting the inside of the uterus, it should also come out. And there's some data that if it's bigger than 4 centimeters, it should probably either be shrunken or come out. If it's on the outside of the uterus, meaning kind of more into your pelvis, but not deflecting or distorting the inside of the uterus, it does need to come out. So only if they are very large and causing distortion or they are inside the uterus. Otherwise, you're good. They don't need to come out. Why do they need to come out? If it's distorting the cavity, it has biochemical effects on the lining, and that can impact success. If they're right in the cavity, the distortion is enough that it increases miscarriage risks. So you need to be cautious about that. If they're inside the cavity of the uterus, it's really easy to take them out. It can be done hysteroscopically, and they can be shrunken first and then done, or they can be just immediately surgically removed. If they're big and they're in the wall, you need open surgery for that. Are ultrasounds still proceeding as scheduled given the current COVID concerns? Fertility ultrasounds, no. But pregnancy ultrasounds, yes. So hopefully that answers that part of things. We're just finishing tomorrow, and then we're going to be done doing any diagnostic ultrasounds, guys. How long do you stay on baby aspirin if positive pregnancy? Straight through till you have your baby. Stay on the baby aspirin the whole time. There's no reason to stop. How do baby aspirin help to conceive? I've not heard of this before. Again, go on our factor fiction. Improves blood flow, reduces inflammation, is probably anti-inflammatory, and reduces the chances that your immune system will attack an embryo. There are multiple mechanisms that have been proposed, but aspirin is definitely beneficial, and I am a strong believer. Hi, Dr. Victory. I am one of your patients. Hi. I just want to know, when can I make an appointment for my first IUI with you? Thanks and take care. I want to know too. We don't know. We have to wait for guidance to come down from the government and from regulatory bodies and Canadian Fertility and Andrology Society and Society of OBGYN of Canada and the CPSO and the OMA. I mean, there's a million people involved in this. We need to wait until they give us guidance saying we can go ahead. So until then, everything is on standby. I think that was everything. Oh, one question was, what would be the earliest possible date for insemination at this point? I don't know. You know, these are the I left my crystal ball at home questions. The The reality is, I don't know, guys. I'm going to anticipate 2 months at this point. I used to think it would be about a month. There is some data looking at how the virus infection rate is going in Canada, and the last 2 to 3 days, it actually is reaching the peak. So there are other people I just heard earlier today from people within the healthcare community saying the peak is not even here yet. We're going to see it in about a week or so, a week or two. But what I saw in a graph from StatsCan today, it looks like the last couple of days it's leveled off a little bit. And now that many of the provinces are sheltering in, that might drop off even faster. So if everyone does their part, hopefully we can try and shut this down pretty quickly. I have endometriosis and trying to get pregnant. Can I still get pregnant? Endo definitely can interfere with your ability to get pregnant. It depends on how severe your endometriosis is. Mild endo doesn't always interfere. Even severe endo doesn't always interfere. But it can sometimes. So you need to see usually one of us, and there are multiple options. There are medical options. There are some natural options. There are surgical options for patients with endo, and all of these different choices need to be reviewed with you. You need to make an informed choice, and then we move forward from there. At least that's the way I work. I like to educate you, make sure you know all of your options, lay out the risks and benefits of each one, and then let you make your mind up about what you want done. But you definitely can get pregnant. It's just a matter of what will be necessary to help you. There's always hope. You know, there are very, very few people who truly cannot have a baby. Sometimes it may mean needing, testing. It may mean needing treatment. It may mean needing donor eggs, donor sperm, donor embryo, a surrogate. There's all sorts of varieties of possibilities. But there are very few people for whom we can't actually, at the end of the day, achieve a baby. I can't always promise you it will genetically be you and your partner, but I can virtually promise everybody we have a very strong chance of getting you a baby. Okay, after 2 rounds of Provera with no results, what's the next step to jumpstart a cycle? Well, that's a great question. It depends on your diagnosis. So if your diagnosis is PCOS, then I need to redo hormonal testing for you. You would want to make sure that your testosterone levels aren't very high. And you also want to make sure you're not already pregnant. So you need a couple of hormonal tests. You need your thyroid check, things like that. If you're not PCOS, then we need a test both with ultrasound and with blood tests to determine what your ovarian function is like, and the hormones, again, we want to make sure it's not a premature menopause or an ovarian suppression. So it all depends on what's going on. There's no one answer to that question, but you do need an ultrasound and some testing. I have first step of it and had surgery where they had to remove the blood. Oh, this is back to that endo question. If you just had stage 1 endo and you had surgery where they zapped it, that almost doubles your success rate. The EndoCan study showed that your success rate for endometriosis related pregnancy chances went from 26% to 46% after surgery for stage 1 endo. So you should have an improved chance just from the surgery. You may need more therapy than that, but that provides you with a pretty reasonable chance. Let's see if there's any new Instagrammers. Yep. I am 21 weeks pregnant. I have my next checkup on April 9th. Is it safe to come in? Are you still doing these appointments? Yeah, we have to do your OB appointments. So OB patients are still coming in, and we need you to come in. I can't do your blood pressure or your measurements or check your fetal heartbeat from home, guys. So you have to come in for those. But as I mentioned earlier in the program, and I apologize again, we've had lots of glitching with our system here tonight. They definitely are taking every precaution they can. I'm wearing a mask. I am hand scrubbing every time I see you, and then before and after. We are literally cava wiping our benches and tables and computers and seats and everything to death. God bless all my staff. They went crazy today cleaning and wiping. Mara running in between rooms, and Diane and Allison. and everybody else, Ashley at the front, working their tails off. So thank you, ladies. I love you all, and you're amazing. I am constantly in awe of how hard you all work. So that's amazing. So yeah, you'll still be coming in for your OB is the short answer. Can Lupron delay your cycle? Lupron definitely delays your cycle. Your first cycle may still come, but after that, you actually should not get a cycle if you've taken Lupron, especially if you've taken the 3-month version, because it's supposed to suppress your hormones in order to reduce estrogen, so that whether you have endo or fibroids, they both get treated appropriately. So you may get a first period if you took it on like cycle day 21, but your subsequent periods should not come at all, or very rarely do. Okay, actually I think it's 9, and I think we are all done questions. Okay guys, any other questions? I will stay on for an extra 5 minutes if anybody has any questions they want to ask. My apologies to the Instagram and Twitter and YouTube crews. You know what? I don't know what the hell is going on with the internet here. We will have it figured out by next time. We may do a practice run. So if you see us, we may get a couple of you to sign on in the middle of the day or something. It'll be a practice, and I'll just announce it as a practice. So don't watch if you're in the middle of work or driving or something like that, God forbid. Anybody else have any questions, guys? I think we're probably pretty good. Okay, so to all those of you who suffered through the glitches, my apologies. I promise we will get it sorted out. Fact or fiction was obviously about letrozole and frozen embryo transfers, and the fact is, yes, you should be getting it. All of you, please, please, please stay safe. Lots of hand washing, social distancing, social distancing, social distancing. It is the real deal. You need to stay away from other people. Within your family, it's probably fine, but if someone's going out and exposing themselves within your family, stay away from them too. Matt, my son, if you're watching, get home now, or I'm going to kill you, son. And for everybody else, we're good. One last question here. Will you prescribe diclectin before a consult is available? I can't prescribe anything to somebody unless a consult has been done, because that would be illegal. So no, you can do it through your family doc. But we cannot prescribe anything to you till we've seen you or taken care of things. Okay, guys, lots of love. Have a great night. Thank you, and we will see you again soon. Have a great evening. Bye now.